we're here to talk about artificial intelligence and how it relates to the medtech industry at St. Cloud State University and what SCSU has been doing to bridge that gap. We're going to do some brief introduction. If we could just get who you are, what your professional background is, and how that relates to artificial intelligence, I think that'd be good. So we'll just start with Brian.
I was the vice president of regulatory affairs at Boston Scientific for about 30 years and recently retired. I've been involved with St. Cloud State University this is my 15th year teaching courses in the regulatory affairs master's program. Artificial intelligence has been around for a long time in medtech. We've had devices that can communicate remotely. They can make some simple decisions. But as we see that maturing and becoming much more sophisticated, it's opening up new possibilities, but it's also opening up new risks. I'm very curious as to your thoughts today on AI and how it relates to medtech.
Absolutely. All right. So, Grant.
Hello, I am Vice President of Quality and Regulatory at EnsoData. It's a sleep processing company. So they take sleep studies and analyze them. I have 26 years in medical devices, 10 of which are solely regulatory. The 16 before that were technical publications, user manuals. So there is some historic AI in there previously at other companies, but this is med devices, so we don't talk about that. I have more experience in AI as part of the device than I do in AI as part of our daily work, but I will contribute the bits that we do.
I think that's important too, though. If the AI and the devices is something that you need to be aware of and understand how it works, the limitations and the risks. It's all pretty relevant to the discussion. All right, Matilda?
I've been in regulatory affairs for 7 years now. 4 of those were with Boston Scientific as a regulatory professional. And then 2 of those years has been with my current company, Medtronic. I work with digital health products and currently supporting some AI-enabled products such as Link ICM. I graduated from St. Cloud State University, class of 2019. Yeah, I'm excited to be here.
So our agenda is to do a brief overview so that we're all on the same page. As somebody that doesn't have much, if any, med device experience, my experience is elsewhere. And we don't talk about that. And then a discussion about AI and the roles that are in the programs, staying up to date with new developments, tips on how to do that, and then the effects on regulatory processes and the conversations we're having there. I'd like to wrap that up with talking about advancing AI in education. All right. I wanted to touch base. I feel like most of what I've heard is in machine learning and deep learning as far as quality and compliance and data analysis, but I'd like to hear some feedback.
I'll jump in. One of the things that we deal with quite a bit in regulatory is decision-making based on a number of inputs. So a very common one is when you have a class 3 PMA product and you do a change to that product, we call it post-market change management. There are a number of factors that FDA has identified that drive you to make a decision on whether something is a prior approval from FDA before you can make that change, or it's something you can document and just move on. This is something that we spend a ton of time on in the industry. If you're a regulatory professional working at a company like Medtronic, you know that post-market change management becomes a huge part of your job. And using AI to help make some of those decisions, or at least get us to a certain point in the process, alleviates some of the human touch points and makes that much more efficient. So that is an area that I think is very much something that companies are looking at, is how can we automate this to a degree using some simple AI? If we're making 100 decisions a week, can we make 60 of them or 70 of them and be right 99% of the time using some sort of AI algorithm. That is a very attractive option. And I know companies are already moving in that direction. Before I left Boston Scientific, there was some early work going on to try to automate some of this and alleviate some of that burden. So that's an area, this decision making, that I think is something we're looking at from an AI perspective.
Absolutely. I think that rolls really well into the next section that I wanted to talk about, which is that regulatory and critical thinking. Since you're speaking to it, I'm curious about how are you bringing some of that knowledge into the courses, if you don't mind.
I'd be happy to. So in RAS 625, which is the PMA course, we spend a lot of time talking about market change management. And we really try to teach the fundamentals. What decisions need to be made? What are the consequences of those decisions? How do you deal with them from a regulatory perspective in terms of paperwork and submissions to FDA? So we're teaching students how to do that work. We're not really focusing on how would you automate that because there is no standardized solution yet. We're trying to make students aware that this is an opportunity. Companies are looking at using AI to try to make this process more efficient. So you really have to understand the basics of how these decisions are made before you jump in and start automating.
Sure. So it sounds like we're focusing more on learning organically in the courses.
I do want to add one other thought here, and that is when it comes to interacting with FDA, we talk a lot about understanding your product and being able to have that conversation with the agency. And one of the things that FDA has been interested in historically is process of if your device is rendering information, how far does that go? So if you're using AI to present information more efficiently to a physician so that physician can make a decision, FDA is fine with that. In fact, they support that. But if your AI goes to the point where you are making a medical decision in the absence of physician input, they have historically said that is not acceptable to have a device that is rendering a medical decision or potentially taking action. For example, take a pacemaker. You can imagine that if the device was analyzing data coming from the patient and saying, we need to alter the programming of this device and did so automatically, that would be over the line. Versus I'm going to present information to a physician that indicates we should probably modify these programming parameters, but the physician has to make that decision.
I did see Sigrid nodding her head, and I was going to ask what your thoughts were.
We, with one group, did a Q-sub for a device that would have used AI and given directly a diagnosis with no intervention. The doctor would have to have taken that and made a treatment out of that. It didn't just prescribe something and there was no physician intervention, but there was no physician diagnosis. It was all AI. And that crashed and burned faster than I would have predicted. So there is definitely a hesitation not to have human intervention in review of what the algorithm has told the doctor. Providing more information to the end user about what the algorithm is doing and deciding gets you further down that path to what the algorithm can give as a result if the clinician using it understands how that result was obtained. I have noticed, though, the FDA with the predetermined change control plan, I think that might be the right acronym, where you can submit a plan for what you're going to have your algorithm changes, explain the methodologies you're going to use and the expansion you're going to do with your algorithm. So that's opening the door a little. It's still not removing a human from the end equation of use, but I think the FDA is getting more comfortable with AI. I'm not sure how comfortable they would be with AI in use for the regulatory decisions, like Brian was talking about, just from a startup small business standpoint, we don't have the funds or the personnel to do that. And I would be curious how specialized that would be to have those decisions made. I'd be very curious about that. Interesting, but I don't see that happening on a smaller business scale. It would have to be some of the larger players.
Matilda, you're in regulatory affairs and you work with products that have AI integrated into them. Are you using any tool that help you sift through regulatory data?
In terms of things we use for regulatory, we have some generative AI tools that help us be more streamlined in how we prepare our submission so that we are telling our story accurately and correctly to reviewers. Those are tools created within Medtronic to help our regulatory professional move more efficiently.
One question going over to Sigrid and Matilda, you're both fairly recent alumni. Do you think the information that you learned at SCSU has helped you reason through and figure out AI as far as learning those skills and critical thinking about risks? I'd like to hear your input on what tools have helped you at navigating this.
I would think with the critical thinking that I developed in the program, I was able to leverage those skills of finding tools, and the skill set that I learned from the program has been very essential in helping me.
And I can weigh in a little bit. In the time I was in the SCSU program, I agree with Matilda. The critical thinking, where to look, how to interpret the text that you're reading and the way regulations are written helps in keeping up with all of the AI things that have come out. Since I've graduated, there have been more things coming out from various markets on their stances on AI. I will say all of that 26 years with medical devices, even though they didn't call it that, it's been AI. It's been around. It might have started as machine learning, but there were algorithms in there, and it just finally got accepted by the FDA to allow AI. I remember advising somebody not to use the term AI in their submission because the FDA was not supportive of that term, and it would take them down a path that they wouldn't want to go. I think it would be helpful if the program did have a module or something on AI.
Perfect. I would love to hear some more thoughts about further preparing SCSU students to some of the AI challenges, some things that the faculty can look at integrating as things change so quickly. Having a conversation like this with people that are fully integrated in that and being able to pick your brains is really powerful.
Yeah, I'd like to add a couple of comments around how do people keep up, right? In my experience, there's two drivers, right? There's what I would call FDA driven one, where they're trying to come out with guidance based on what they're seeing across the industry. The way you do that is you go to conferences, you listen to speakers at FDA who are speaking about AI and some of the recent challenges they've seen. That can be really helpful because even if your company isn't doing something, another company might be, and FDA will comment on that. It's a great way to keep up with what's happening out there and what FDA's current thinking is. Wherever FDA is and talking about AI, typically at speaking events, webinars, or whatever, that's kind of where you want to be. The other one is more organic, more company driven. You might have a project that really wants to push the boundaries. Then it's really just company driven, and it's up to you to reach out to FDA or whatever sources you can to try to understand. MedTech is a huge space, and there's always another company probably pushing the boundaries more than you are. And so getting out there and understanding what's FDA's latest thinking and why are they thinking that, those are really the two scenarios that you're going to be facing.
I wouldn't forget about your classmates in your room. Stay on friendly terms with them. Be a good project mate. use your LinkedIn network because those are always helpful people. You don't have to give away company secrets, but sometimes it's helpful to bounce something off of somebody.
Perfect. And that definitely answered the question of how do you keep up with the things going on? I've heard instructors in classes point out places to look for trends, things that you should be exploring, places that you can poke around, and definitely learning from other experiences and other people. I would really like to dig a little further into what Sigrid said about things that we could do to include topics about AI where it's relevant to the medtech industry. Do you have some ideas of some of the things that you've seen that people are missing coming in?
I think we need to help students be aware of the role AI plays and what its limitations are. I'm going to make a list of the top 5 teaching points I want to make sure I cover. I think it's that limitations piece that I would put near the top of the list. Right now, AI has got so much promise and so much opportunity, but you really need to be careful on how it's used and when it's used, and make sure that whether it's a pre-market submission or post-market surveillance, you still have to have that oversight component. But that's where I would start with students. From a medtech perspective, here's the role you need to play. And it can be a tool, but I don't think it can do your job for you.
Sure. I could see that. If I was to try to condense that, it's using AI a lot like you would maybe this is statistical processing software. You know its limitations, you know how to use it, you know how to prompt it to get the results that you want, but you're not relying solely.
I would agree with that. In something that's regulatory adjacent, all of the regulations on translations, localization, and all that, well, probably 20, 25 years ago, the translation companies, with the explosion of the regulations on thou shalt have thine medical device in the language of the country, they had a lot more business, but they had to have speed. So they started using rudimentary machine learning. They got into some natural language processing. But for the medical devices, there still was a human reviewing a native language speaker with expertise. So I think there's spots that it can make you more efficient, cheaper, faster, better.
Yeah.
To agree with Brian, we are not to that point where it is sophisticated enough to just wholesale use an AI algorithm for an output. I'd like to add into the AI literacy part is also talking to students in the classes about not just AI as helping you with your job, but the AI in the products that you are working with as a regulatory person. How do you figure out what that does? What level should you go to of learning that? How much information do you need to help make that decision? Or figure out, do you need a submission? Do you not need a submission? Is this thing you found in post-market surveillance important or not? It can be difficult, but also just understanding how much you might need to know about the algorithms and use in the devices would be important.
And that really links us to our MTQ program, Sigrid. That's where I feel like our regulatory program and our medical technology quality program have some overlap.
Sure.
For example, the MTQ 630 course that involves verification, validation, and clinical effectiveness. And it's a second year MTQ course, but it's a course that our regulatory students are now opting into because it's giving them greater perspective on this very topic and helping them to develop further critical thinking skills. The regulatory compliance course, they're now using Basel Systems software to showcase how AI tools can be used to help get to the data that can enable quicker decisions. There are products like that out there that are helping the learning community get familiar with types of tools that they can use for regulatory strategy, for discovery of information in a much more readable format. Could they get that from the FDA public site? Yes. But now it's being presented in a way that gives them some consistency in how they can look at things from a competitive intelligence standpoint. It gives them some consistency in terms of product families and how they can dig in to the data through different pathways. So they're getting that in the classroom now, which is different than perhaps what we were doing not even 6 years ago.
Oh, yeah, that's excellent. I am getting some of that background education. Just as a side note, the person who works for me as a software QA engineer, his degree is from St. Cloud State in the MTQ area. So that's also helpful.
Here on how we could bring more AI focus into our curriculum is much like we talk about regulatory all the time, which is when FDA enacts a new regulation, a really good place to go look is warning letters. So who has made an attempt and failed and gotten feedback from FDA? And oftentimes these cutting edge things, that's where you're going to get that critical thinking from FDA. They decided, no, can't do it that way. Here's a warning letter. And they spell out why they have a problem with it. It's pretty low right now in terms of FDA's comfort level. But if there are examples where people have tried to push the boundaries and gotten feedback, that is just a great place to bring that learning into our courses.
I had a thought on MTQ and we do process capabilities and we use Binitab. If there was a way to take a simple assignment that has a data set and analyze it. And then if there's a tool that should help you analyze based off of machine learning, where it's taking that data set, making predictions for you so that somebody can learn how it functions.
That would be excellent. Then people at least have the terminology concept of the flow and where stuff happens in the whole process. That I think that would be very helpful.
And then you get a side-by-side comparison of the statistical analysis version, going through that and how they differ. What happens if you change an input? Because inputs equal outputs. If you get bad inputs, you get bad outputs.
Another thing that will be helpful is to know about what tools are out there that can help summarize the different guidance documents and give you the key details that you need in order to apply that into a submission you're working on or pre-market work you're doing.
I do think that they have been doing that. I think Kathy had mentioned some sort of special topic where they were investigating prompting AI in order to get good outputs. It's a computer. If you don't have experience in computer programming, you have to learn how to talk to it in order to get what you want, right?
It's like with the course that I teach in quality science, which is new. I don't know that those courses were in play when either of you were going through the program. In the exercises that I have the students do, sometimes I intentionally ask them to use AI to help them with their research and identify the prompts that they're using, because the prompts are what then are helping them to determine the critical aspects of what it is that they're being asked to do. And the data that comes out, depending on the tool that is used, if not prompted accurately, as Olga said earlier, data in equals data out. So it may not capture accurate details. You have to also apply critical thinking and verify the output in order to justify that is in alignment with what you're doing.
That's a good way to give people experience with it. I'm just adding the caveat for people who might end up working at a place where all they have are the open tools, to be aware that their company may not appreciate the intellectual property going into an open source tool. We have had concerns in the smaller businesses. How much do you say into one of those more open ones where you can't afford to have your own in-house or afford to have your own instance that nobody can access? That is a deterrent for a lot of the smaller companies. You don't want to be contributing your IP into the mass of information.
All right. Looks like we've only got a couple minutes left. Well, I wanted to thank you all for joining us and letting me pick your brain. I don't know if there's any other comments or questions that people wanted to add. All right. I will let you get back to your day and thank you all.